Almost everyone has been involved in some sort of sport. It could have been elementary school soccer, neighborhood stickball, Little League baseball, high school field hockey, college football, or a weekend pickup hockey game. The list goes on and on. Associated with sports is another list, a list of injuries. Broken bones, sprained joints, pulled muscles, and unfortunately, contusions, concussions, and spinal injuries. Today, we'll get some insight into sports injuries from a specialist, Professor Robb Rehberg. Professor Rehberg is Associate Professor and Coordinator of Athletic Training and Clinical Education at William Paterson. Among his many achievements, he is on the Board of Trustees of the Brain Injury Association of New Jersey, an inductee in the Athletic Trainer Society of New Jersey Hall of Fame, and the author of Sports Emergency Care, A Team Approach. Welcome, Professor.
Thanks, Kelly.
So I understand you've researched in the area of concussions and you've worked extensively with concussion patients. So what motivated you to focus in this particular area?
Well, I spent 10 years as a football player in high school and a little bit of college, and then 14 years as a high school athletic trainer. And I had my share of concussions when I was an athlete, and certainly took care of enough concussions as an athletic trainer at the high school. And most recently had the opportunity to work with patients at a hospital in the local area with concussion. And it's always been interesting to me because it's a type of injury that you can't see. And that's what's always been fascinating to me.
So how easy is it to get a concussion? I know you said you've had some yourself.
Well, Kelly, the thing about concussion is if you sustain a concussion, you own it. Everybody's different. You and I could hit our heads the exact same way, and you may not sustain a concussion, but I might. If we both had a concussion, you may resolve in a couple of days. It might take me a couple of weeks or a couple of months. So there is no one set way to get a concussion or how one amount of force that you need to sustain a concussion. It's very individual in nature.
What are some of the signs of a concussion?
Well, some of the obvious signs that you always hear about in a concussion involve headache, dizziness. Sometimes it'll involve loss of consciousness, but in fewer than 10% of the cases that's true. But other more subtle symptoms that oftentimes people don't associate with concussion, such as difficulty with their sleep patterns or difficulty concentrating, difficulty remembering certain things, feeling like you're in a fog. Those are all of other symptoms that really people don't think about as much as the big ones like a headache or loss of consciousness.
What are the long-term ramifications of a single concussion and multiple concussions?
Well, that's the real fascinating thing about the research that's coming out these days. It seems like a new paper is coming out every week or every month about what we're finding out about the long-term effects of concussion. Even what we call subconcussive blows, meaning if you've hit your head day after day like a lineman in football, where you don't have those symptoms every single day of concussion, but cumulatively they end up creating more of a problem later on and can cause minor issues in terms of headaches and sleeplessness to longer-term issues like a condition we're learning about now called chronic traumatic encephalopathy, which can cause some premature dementia as well as other associated symptoms.
Now, briefly, can you talk us through a specific case of concussion that you've studied to give us an example of the step-by-step scenario?
Well, again, since they're so individual, I can give you the two sides of the coin. A lot of times for years in first aid books and sports medicine books, we talked about concussions and whether or not there was a loss of consciousness. One case in particular I can talk about is a case where there was a loss of consciousness, but with the proper care, which was followed up, or started initially with the athletic trainer on the scene, and then the follow-up care through a physician. That case in that football player, this was a football player, resolved in a matter of about 7 to 10 days, and they were asymptomatic. Other cases where we have somebody who never lost consciousness and had a headache and didn't report it and didn't talk about it and just went back into play, which is probably the most serious thing that an athlete can do, had symptoms that lasted for weeks and actually months and ended up impacting their ability in school, their sleep patterns, and their lifestyle.
And finally, what are the best ways a student athlete can protect him or herself?
Kelly, the best way they can protect themselves is being educated about concussion. It's not like an ankle sprain. You and I can sprain our ankles and sometimes want to play through it. And you really can't do that with a concussion. Your brain needs to heal. It's one of the most important organs that we have. We need to know the symptoms of concussion. We need to know that if we do have any of those symptoms, no matter how small they are, we need to stop exertion and get help from a healthcare provider, an athletic trainer, physician, or other healthcare provider trained in concussion management, and make sure that we don't return to playing until we're asymptomatic, not just at rest, but also with exertion and playing our sport as well.
Well, thank you, Professor Rehberg.
Thank you.
Sports injuries can be a physical and emotional nightmare, But knowledge, preparation, and prevention are the best ways to avoid a worst-case scenario. If you're interested in any area of kinesiology, which includes athletic training education and exercise science, please make an appointment to speak to a professor through the kinesiology office at extension 2362.